In our series of lectures on gastroenterology portion of the internal medicine, we started off by talking about the various gastroenterology disorders and then moved on to the hepatic system. Today, we are going to talk about the biliary system and biliary system related pathologies. The major topic of discussion is the primary sclerosing cholangitis among a long list of biliary pathologies. So, before going into the details, as is our system of discussing every disease, let's first focus on the nomenclature. Primary sclerosing cholangitis is composed of three major words. Primary suggests that it is a primary disorder. It is not secondary to any illness. So this disorder arises on its own rather than it being a reactionary disorder as compared to the secondary disorders. Sclerosing generally means a fibrotic disease or a fibrosis or hardening. So this disease is a primary disease which involves hardening or fibrosis. And cholangitis means inflammation of the bile duct. Cholange basically in medicine means bile duct or bile duct related structures, and itis means inflammation. So to sum up the nomenclature, this is a primary disorder involving the bile ducts, and it involves the hardening or fibrosis of the bile duct. And this gives us almost all the details of the disorder. How will the disease present? What can be the pathophysiology? If you understand the nomenclature, then you can make out all the signs and symptoms and clinical features that the disease will present with. So, to reiterate the same point which we discussed in the nomenclature, if we look at this biliary tract, this is the liver and this is the biliary system, the intrahepatic and the extrahepatic biliary system, the gallbladder. What happens in primary sclerosing cholangitis is is evident in these two slides. This is a normal representation of a bile duct. This can be an intrahepatic or extrahepatic bile duct. This disorder involves both the portions of the bile duct, the intrahepatic portion or the extrahepatic portion or the common bile duct, which is formed by cystic duct and the common hepatic duct, as we all know. This is the normal architecture of the liver. In a normal person, this is how the bile duct moves. The bile flows through these ducts into the channels and then moves onwards into the duodenum. What happens in primary sclerosing cholangitis, or the disease PSC as we abbreviate it is, there is some pathology going on that causes the sclerosis or the fibrosis of the bile ducts. It can be from inside the bile duct, like for example, if there is a bile duct and then there is fibrosis or inflammation going on the inside part, or it can be just outside of the bile duct, as it is shown here. The area surrounding the bile duct, if you compare it to the normal, undergoes hardening or sclerosis. There is collagen deposition here, there is fibrosis. This leads to stenosis of certain parts of the bile duct, and the part adjoining to that stenotic area undergoes dilatation because the bile has problem passing through that stenotic area, and it gets accumulated on the top of that stenotic area. That area then undergoes dilatation. This is the hallmark of this pathology: alternating stenosis and dilatation. This will be very evident when we look at the few radiographs moving forward in the lecture. So I want you to make a clinical picture of the disease in your mind, that this is a primary disorder involving the bile ducts, whether intrahepatic or extrahepatic bile ducts, in which there is a beading pattern, like beads on a string. There is alternating stenosis and dilatation of the bile duct. What happens now if there is sclerosis and dilatation of the bile duct? As you can imagine that as compared to a normal bile duct, the bile will have a lot of problems passing through this stenotic area. So this will lead to accumulation of the bile upstream, and we will have a similar picture as we have in anyone undergoing obstruction of the bile duct, which we generally in medical terms call a cholestatic picture, which leads to the stasis of the flow of the bile. Cholestasis means stasis of the cholesterol flow, or in general terms you can relate it to as stasis of the bile flow. So this is the primary pathology, and all the clinical features and all the signs and symptoms are related to this disorder, which we are going to see as we are going to discuss the clinical features and symptomatology. A few important facts regarding the primary sclerosing cholangitis. This disease is generally more common in males as compared to females, and it happens roughly around 20 to 40 years of age. This is the median age of presentation. It can happen in elderly population as well, or in certain pediatric population, but that is generally very rare as compared to the normal 20 to 40 years of age bracket. And males are affected generally more than females for no known reasons. And there is no definite pathophysiological mechanism that is attributed to this disease. So we have some postulated mechanisms which we are going to talk about when we are going to discuss the pathophysiology.